Great. Hello, everybody. Thank you so much for joining us for another one of our nutritional webinars. This month, we're going to be talking about the different types of calcium that are available from standard process and when you should use them. And it is my utter delight to introduce to you, for those of you who don't know her, Kim Sperry. She is just a fount of information. And I'm so excited about this webinar. All right, Kim, it's all you.
Thank you so much, Sharon. Well, let's go ahead and get started. So calcium, there are oodles of calcium products on the market. And this discussion is why we may possibly need calcium and what the difference is between calcium and so many of the other calcium products that are on the market, including calcium products that are prescribed by doctors. And then understanding the difference, breaking down the difference between the different types of standard process calcium that we have. So first of all, I do want to say that this information that I'm providing for you today is not necessarily the opinion of standard process or MediHerb. It hasn't been approved of by the FDA. It's not meant to claim or cure or prevent any disease. And what I will tell you is I've put a lot of clinical research into anything that I'm sharing with you. So I do stand behind everything that I'm sharing today. So first of all, our human body contains about 3 pounds of calcium. And if you want a visual for that, that's approximately 5 cups of powdered calcium. And 99% of this is found in our bones and teeth. And the remaining amount, which is 1%, and 1% of this 5 cups is less than a tablespoon. But this less than 1 tablespoon of calcium is responsible for a lot of different things, including keeping our immune system healthy, keeping our central nervous system healthy, managing fever, even regulating heartbeat. So that 1 tablespoon of calcium is critical for a lot of different body functions. Many of our cells have calcium sensing receptors, and calcium ions are found in the intracellular fluid, which would be the cytosol inside of our cells, and the extracellular fluid. And examples of extracellular fluid are lymph system, very important, plasma would be another one, and then our cerebral spinal fluid. And even though calcium is the most abundant mineral in the body, many of us are deficient. So how do you know if you're deficient in calcium? Well, these are some warning signs of what's known as hypocalcemia, and that is a calcium deficiency disease. So these are the early warning signs: muscle cramps or spasms, tendency toward fracture, weak, brittle fingernails, paresthesia. So this was new to me. I didn't realize that numbness and tingling in the hands and feet can be caused by a calcium deficiency. And facial twitching, things that you think are so difficult to solve may be easily solved by addressing calcium. Difficulty swallowing and dry skin can also be attributed to calcium deficiency. And again, here are some other symptoms of calcium deficiency. Fevers in children, but also adults, especially if it's 1 to 2 degrees above normal, is almost always a calcium deficiency. And you can bring down a fever pretty quickly just using calcium. And seizures. So here is febrile seizures, which are seizures that are induced by fever, happen when calcium levels drop below 50%. So again, this is the nervous system being affected. And this also was news to me, is that cataracts can be a calcium deficiency. It's low calcium level in the aqueous humor of the eyes. and the aqueous humor is responsible for lubricating our eyes. Very important also for regulating eye pressure. So I would think not only is calcium going to be important for cataracts, but also glaucoma. Tooth decay. And this also was interesting, is that when you have a deficiency of magnesium, or excuse me, of calcium, you'll have lower magnesium levels in the brain. And there's so much talk these days about anxiety and depression being linked to low magnesium and needing a magnesium that's going to cross the blood-brain barrier, which is important, but it also could be caused by something as simple as a calcium deficiency. Itching, hives, canker sores, mouth ulcers, and viral lesions are not only an allergic manifestation, so these could be histamine intolerance, but also potentially related to hypocalcemia or insufficient calcium. And this, I think, is especially appropriate these days. Here's a study that I found. It's called a retrospective cohort study found in Milan, Italy. And what they did was they closely observed over a period of time 531 patients that were admitted to the hospital. And what they did was they made sure that they ruled out anyone that would normally have a calcium deficiency, like anyone with kidney disease, anyone that had more than one disease, and also any potential patients that were admitted from another hospital. And this is what they found. They found out of these over 500 patients that 462 patients, or 82%, had hypocalcemia. So their conclusion was that hypocalcemia was very much linked to COVID. But not only COVID, but here's another study in North America with SARS, and they found that hypocalcemia was detected in 60 to 70% of patients at a hospital during hospitalization with SARS. Ebola, MERS are all linked to hypocalcemia as well. So this is coming from all over the world. And the mechanism of action for why calcium makes such a huge difference in the immune system is that phagocytosis only takes place in the presence of ionized calcium. And what this means is phagocytosis is killing a foreign invader that should not be in our body. But what happens is without enough calcium, our body basically doesn't identify and kill. So it will not kill foreign materials without enough calcium. In addition to the immune system, calcium impacts the function of all excitable tissues, particularly the nervous system and the heart. So I've already mentioned how important calcium is to the nervous system. We were talking about febrile seizures. But here's some interesting aspects of how calcium affects the heart. So we have calcium sensing receptors on vascular smooth muscle cells, including the arteries, veins, and lymphatics. So here we go with the lymphatics again. And calcium plays a role in the electrical activity of the heart. And this also was new information that cardiac arrhythmia is also a clinical manifestation of hypocalcemia. So it's starting to simplify a lot of these, what could be very complicated issues in the body. And then there's always there's the good and the bad and the ugly of calcium. So here's some of the ugly. Calcium deposition in the vasculature is a consistent feature of cardiovascular disease and is predictive of adverse cardiovascular events. So in other words, bad calcium creates deposits that make it worse. So how do you know? Okay, I need calcium, but I'm also afraid of atherosclerosis. What am I going to do? The deficiency of ionized calcium or the abundance of bad calcium may be a result of 1, limited absorption of calcium, and 2, insufficient hydrochloric acid, which is going to enhance calcium absorption. So there are different things that you could do to find out if you're low in tissue calcium or ionized calcium, excuse me. A serum calcium test you can get. And what this does is it measures your total calcium. So it's going to be not only the calcium that's bound to other minerals, but also calcium bound to proteins. But then the last piece, which is going to be the most important piece and what we're going to be focusing on today, is ionized calcium. It's also known as free calcium, and it is the most active form. And that ionized calcium is responsible for all those important body functions we were talking about earlier. So before I break down the standard process difference between most calciums that are on the market and the calcium products that standard process has, I want you to get very comfortable with the part of the catalog that's known as the key ingredient cross-reference. And hopefully you all have the MediHerb standard process catalog. It's starts, I think it's on page 134, but it's known as the key ingredient cross-reference. What I've got on the screen is something that you can also find online at standardprocess.com. You'll find a search box in the top right, and if you just type in key ingredient cross-reference, you may have to scroll down a bit, but you'll find it. And here I took a picture of the key ingredient cross-reference from my catalog. And I'm going to start with calcium lactate, because calcium lactate powder, out of all of the different types of calcium products that we have, has the most calcium in it. And this is a critical factor. This is what distinguishes us from other forms of calcium and other forms of calcium lactate. So I'm going to talk about other forms of calcium lactate first. Most forms are neutral acid. They are a 7, which means there's no acid to help break down that calcium. Remember that lack of hydrochloric acid is going to be a critical factor as to why you cannot break down calcium and why, if you've got calcium that you can't absorb, where is it going in the body, okay? Our calcium lactate is 5.2 pH, which is considered to be a very bioavailable form of calcium. And it's the metabolic precursor to blood calcium, also known as ionized calcium. It is not to be confused with lactose. There's no lactose in it. It's dairy-free, whey-free, lactose-free. It's considered safe for any of those that are allergic to dairy. And by the way, a lot of people that are allergic to dairy are calcium deficient. So I'd already mentioned that ours is at the correct acid balance for maximum absorption. And then it's bound with lactic acid. And lactic acid, again, is dairy-free, but it's a natural product that's manufactured by the fermentation of beet sugar and the source of calcium lactate. The amount of calcium that's in there, so I've got the calcium lactate powder, which is what I usually take, and 1 tablespoon, remember I was talking about that 1 tablespoon of calcium to 5 cups of calcium, which is basically what's in our body, is important. They give you a scoop, which is 1 tablespoon of the calcium lactate powder, because I take this just about every night. And what I do is I taste it's really hard to take in water. In fact, I found that I just wasn't taking it. So I mix it. I mix it with a little bit of pure tart organic black cherry juice. And I also use a little bit of Simply Limeade. I do half and half. I use about 1/4 cup of each. And what I do is I put it in any kind of a little jar, and I've already got my powder in here, and I just shake it up. And then I just make sure that I take that every night. So I take 1 tablespoon, typically 1 tablespoon at night. If I start to get sick, or if they start to feel funky in any way, I may increase that amount. So for the last couple of days, I've taken 2 tablespoons, in that juice. And I sleep really well. So 1 tablespoon of powder is going to be 800 milligrams of highly usable calcium. And if you're thinking, gosh, that doesn't sound like very much compared to my calcium carbonate that was recommended by my doctor, where I only have to take 1 to get 1,000 milligrams or 2,000 milligrams. We'll talk about that too, okay? So you can do the calcium lactate tablets if you'd like, and the difference is 6 tablets will give you 250 milligrams, and you'd need to take 20 tablets in order to equal 1 tablespoon of powder. So the way I look at it, powder is going to be very easy to digest. It's very easy to take in a little bit of juice, and you're going to get the most amount of calcium. So we already mentioned that the calcium lactate is acidic, which you want it to be in order to digest it. Oh, I tend to do this. I like to look at online reviews of products. And I do that because I like to see what other people or patients are saying throughout the nation in regards to it. And I just couldn't help but notice this. Look at the stars. This is with almost 1,300 ratings. And it's considered Amazon's choice because it's so effective. And it's also very inexpensive. And before I go on to other calcium products by standard process, I do want to share the difference is, and we'll probably talk about it later in some of the slides, the difference is the fact that most calcium products that are on the market are made from calcium carbonate. And that's going to be extremely hard to digest. It's got a very low digestibility rate. It's only about 20 to 40%. So again, think of, okay, if I'm taking a calcium that's so hard to digest, where is that other calcium going? Just keep that in mind. Okay, so now I'm going to go down to the next product in the standard process line that has the most amount of calcium, and that is either Food powder or Wafers. And this is going to be very appropriate for broken bones, broken teeth, holes in the teeth, arthritis and joint health. And this is something that I've researched a lot of regarding Food Wafers for arthritis and joint health. If you're able, please check out my website, kimsberryconsulting.com. Look under resources and you'll find a webinar that's already up there on arthritis and joint health. And you'll see how important Food Wafers is for that. In addition, it can be used for osteoporosis, and there is a clinical study on standardprocess.com showing that within 90 days of using Food Wafers that it decreased osteoporosis by almost 20%. Can also be used as a wafer, or excuse me, a prenatal. And I take Food Wafers during the day. So I'm getting 2 sources of calcium, one during the day and one at night. It's considered a nutrient-rich gold mine. And the reason why is because Food is a source of bone marrow, type 1 collagen, glycosaminoglycans, and gelatin. All of this is in Calcifood. Consider this bone broth in a chewable tablet. Very, very important. It's made from the spines and ribs of raw veal bone. And I do feed this to my cat. So I wanted to share this piece with you. When I have a kitten she's now 6 months old, and my friend Trisha, who raises purebred Persians, said, Kim, if you want to avoid ghastly bills, like dental bills, feed your cat raw chicken neck. Fantastic. So she starts her morning with raw chicken neck. But it turns out that her favorite snack by standard process is Calcifood wafers. So I wouldn't recommend for a cat that you try to break the wafer. What I do, and it's perfect because then I'm getting the benefit as well, is I chew a wafer first, mix it with a lot of saliva, put it in my hand, and she just licks the paste right off my hand. She loves it. And she probably gets 2 Calcifood wafers a day. I want to avoid those ghastly dental bills and keep her strong and healthy. So here's some more on Calcifood, because I just think it's such an amazing product. The fact that it's an excellent source of protein and minerals. It's also a source of glutamine. So Calcifood wafers is going to be great for healing your gut. So the glutamine is found in raw bone and is one of the few amino acids that can directly cross the blood-brain barrier. That's another very important piece for anxiety. And then the intestinal epithelial cells are activated by the immune cells, The intestinal epithelial cells and activated immune cells eagerly consume glutamine for cellular energy. Also important too for our gut and our immune system. And then it supports protein metabolism and the immune system, which we've talked about, as well as skeletal and muscular and cellular health. Supports protein metabolism because of the protein that's in there, and also contains lysine, which helps with proper collagen formation. It needs to be raw. So that's one thing my friend Trisha warned me about. Absolutely do not cook this bone, give it to her raw, which makes sense. So Calcifood is not to be confused with bone meal. Bone meal products are steamed. They are considered nutritionally dead. This is not only a source of calcium, but it also has phosphorus. And think of a need for Calcifood when you've got calcium deficient patients, but also don't have a lot of energy. They feel exhausted or feeling worn down. The phosphorus in there is probably going to help them with energy. There's rice bran in there, which is a source of riboflavin. And in a riboflavin deficiency, calcium has a tendency to, here we go again, accumulate in soft tissues where it does not belong. That's a good example of bad calcium. This is going to help break down calcium and prevent calcium going into soft tissues where it doesn't belong. You're getting approximately 100 milligrams of highly absorbable calcium per wafer. An average amount that I recommend is 6 per day. There is wheat germ in there, and there's a reason why, and it's because bones also contain bone marrow, and bone marrow tends to be very oily by nature. So in order to absorb the bone marrow, type 1 collagen and gelatin, rather than getting rid of it, wheat germ is added to add an extra source of wonderful energy and vitamin E, and to absorb all of that greasy goodness that's found naturally in the bones. Type 1 collagen, which is found in Calcifood, is found in tendons, skin, artery walls, cornea, so here again, eye health, and the endomysium surrounding the muscle fibers, which has to do with the connective tissue, fibrocartilage, and the organic parts of bones and teeth. So Food shouldn't just be thought of for broken bones. Definitely, you can see why it's going to be really important for arthritis, as well as anything that involves collagen or anything that we've talked about so far. Again, very important for connective tissue. And I thought this was interesting too, that type 1 collagen mutations have documented important roles in a range of diseases, with particular focus on bone and connective tissue disease. Type 1 collagen is particularly important in bone, skin, and connective tissue. The next product down the line is Cyril Food. And Cyril Food has basically got all of the benefits of Food. If you don't want to take the powder or the chewable wafers, Cyril Food is a tablet that you swallow. You can also get it in powder. And it's a little different than Food in that it's a combination of catalin, Food, some extra fiber, reishi, and shiitake mushroom powder. So this also is going to be, can be used as an excellent prenatal and postnatal. It's also a source of raw bone, so it's going to have all the benefits of Food plus vitamins, minerals, and fiber. My personal favorite is still going to be Food because I really think that you should chew this or take it in a powdered form. It's going to be easier to digest rather than swallowing a tablet. This is an important product, and it's lower in calcium since we're going down the list in order of priority, but very critical to talk about. And these are the specific reasons when you would use Calma Plus. Definitely when you're dealing with someone who has had a calcium deficiency for a long period of time. And the reason why is because when you've had calcium deficiency for a long period of time, your parathyroid gets involved. And what it does is it maintains blood calcium, or that ionized calcium levels, but at the expense of our bones. So what happens is our parathyroid pulls calcium from the bones to be able to put into the blood. So you end up with loss of bone turnover, you have bone loss, and increased risk of fractures. So the beauty of Calma Plus is it's going to provide parathyroid support. So it's going to balance the parathyroid. And I will say that underactive and overactive parathyroid glands will throw the calcium balance off. And because it's the protomorphogen, it has a balancing effect on the parathyroid gland. So you can use it for either hypo or hyperparathyroidism. So it's going to calm down that parathyroid while you provide some extra calcium. My recommendation, if you're dealing with someone with advanced hypocalcemia, is use calcium lactate powder along with the Calma Plus. That way you're establishing balance in the system while providing the badly needed calcium. And here's another little piece on the parathyroid, that endogenous parathyroid is the primary regulator of calcium and phosphate metabolism in the bone and kidney. It has a net effect of stimulating new bone formation, leading to increased bone mineral density. And here I thought this was interesting that I learned as a result of all this research, is that restless leg syndrome. We know it's associated with different things, including vitamin D deficiency, even magnesium deficiency, but that restless leg syndrome is associated with hyperparathyroidism. So Calma Plus is going to be very important for restless leg syndrome, especially if they've got the other manifestations of low calcium levels. Going down the line, Calsol. And I'm hoping my intention of this webinar is to be able to demystify and help you to have a very clear understanding of the different calcium products so that you know exactly which ones to go to based on the conditions that you're working with. Cal-Sol, I would think of as a vegetarian substitute for the Food or the Cyril Food. Again, ideally, I'm going to recommend the Food or the Cyril Food just because it's going to be, has all the benefits of bone broth. But Cal-Sol provides you with similar effects and being a vegetarian. And again, it's a calcium phosphorus balanced product, so it's going to be good for the teeth and mineralization. The next product is Cal-MO. So again, we're going further down the line. And Cal-MO, I would not think of as a source of calcium, but I would think of it primarily as an electrolyte, and this is why. So first of all, the main types of electrolytes that are found in our body are calcium, sodium, potassium, chloride, magnesium, and bicarbonate. And out of these electrolytes, potassium, sodium, and chloride ions are considered the most essential electrolytes regarding hydration. And Cal-MO supports optimal body pH. It's been around since 1952, also gets rave reviews. And this is where I would think of it. So we were talking about bad calcium. And think about all those patients that have been on the wrong kinds of calcium for years. Chances are they've got bone spurs. Can also be, Cal-MO can also be used for allergies and hydration, as we just mentioned. So let's talk about bone spurs first. So bone spurs can be very painful. Aside from being uncomfortable and restricting mobility, they can break off and float in our joints or become stuck in our synovial fluids, which can be very painful. And you'll learn more about synovial fluid and the joints if you listen to that arthritis joint health webinar. Plantar fasciitis is a very painful condition as well. And this can come from poor blood supply. And that poor blood supply, I just want to share, that poor blood supply, first of all, can come from infected synovial fluid. And that infected synovial fluid could just be a result of a bone spur. So it mentions here injury, weak porous bones, scar tissue, or some kind of damage. This is considered dead bone or dead calcium that contributes to plantar fasciitis. And Cal-MO will break down this dead tissue. It does not dissolve or harm healthy bone, but it sure is good at breaking down bad bones or bad calcium. Okay, so think of Cal-MO as going after bad bone. Okay. So the ingredients in Cal-MO keep calcium more fluid to make sure it doesn't form clumps that later turn into bone spurs. So in short, Cal-MO helps ensure calcium stays where it should be, dissolves calcium in places where it shouldn't be, and prevents it from building up there again. And these are some of the other contributing factors to bone spurs and plantar fasciitis, such as weight gain, improper gait, and intense physical activity. Arch support is going to be very important as well. And again, I had to put this in because I just thought this was cool. Here's a specific patient review regarding bone spurs and Cal-MO. He said, oh, I took this product from 1993 for a heel spur. I work on my feet all day long. And actually, I can't read the whole thing. It said the Cal-MO helped to eliminate the product and it prevented surgery, which is great. I would have rated it 5 stars back then. And I just started taking it again for my knee and my elbow in hopes that it will again heal the problem and prevent surgery. So he wrote that in 2018. So it sounds like he was off of it for a while. Now, this is a very interesting piece. It was sharing the fact that CalMO is an important electrolyte, but the way I learned about CalMO years ago from Dr. Dick Versendahl is he talked about how important it was for increasing cerebral spinal fluid. And I want to give you a very specific example, and that is of the brain. So our brain and our spinal cord float in cerebral spinal fluid. So that means if we hit our head or we hit our body, that cerebral spinal fluid, one of the functions is to lessen the impact. And actually, our brain would feel a lot heavier in our body without that cerebral spinal fluid. So with it, it mentions here that the weight of the brain is reduced from about 1,400 grams to about 50 grams. So the pressure at the base of the brain is reduced as long as we have the right amounts of cerebral spinal fluid. So in addition to lessening the impact, it circulates waste products out of the brain. Very, very important, and provides cushioning and support. And a very specific symptom is if this fluid is too low, it says the brain may sag downward when the patient is upright, stretching the meninges and nerves lining the brain and causing pain. Classic symptom is a headache that becomes severe when the patient is upright and quickly disappears when the patient is lying flat. Again, think, cerebral spinal fluid, maybe CalMO will help. So thus, headaches are typically absent first thing in the morning, and they start or worsen shortly after getting out of bed. Pain is often worse at the back of the head and may be accompanied by some neck discomfort and nausea. And then as far as a humidifier, natural body humidifier or electrolyte, CalMO is going to be very important in high humidity areas. Sometimes if potassium isn't helping with dehydration, CalMO more than likely will, because it provides all those other important electrolytes. Here are a few other symptoms. Can be used for patients that often dizzy, backaches in the fourth lumbar region, heat prostration, swollen ankles. Average is 3 to 6 daily, and you can take up to 15 daily with extreme need. Usually you don't have to be on that for more than a few days at that high amount. I wanted to put this in too, because this is someone that I worked with personally who, she and I were having lunch and she was telling me some of her symptoms. She was actually afraid she was going to have, had a brain tumor, and I started sharing information on CalMO. And this was the email that she wrote back to me the very next day. She said, "Good morning, Kim. Thank you so much for all that great information yesterday. I think that CalMO is making a huge difference." This is one night. Today, I'm going to also add the celery seed because I love celery for the brain. "I slept so good last night, woke up clear and no headache. I was seriously beginning to wonder if I had a brain tumor." Okay, so I've gone through the majority of products that are used as a source of calcium, and now what I'd like to do is just give you a few miscellaneous clinical pearls that different doctors have shared with me. So we already realized how important calcium is to our immune system and how it helps with viruses. So of course, cold sores, herpes outbreak, definitely think low calcium. You can use 6 calcium lactate tablets, or you can use the powder. 1 or 2 Cataplex F tablets. Cataplex F is used to help pull it into the tissues. And 1 St. John's wort tablets, because St. John's wort also has antiviral effects. Use the above dosage several times a day to prevent breakout. And if the breakout has already occurred, use the same formula for speeding up the healing process. And this was fun because I taught this study group in Los Altos, and Lisa Herndon shared this with me, that she keeps a baggie of calcium lactate, so she's using the tablets, and MediHerb Cramplex in her purse. And she said, if I'm having a leg cramp, I take two calcium lactate to one Cramplex. It's usually gone within a few minutes, and if not, I repeat. She also gives calcium lactate to her daughter for period cramps, and it's usually gone within 20 to 30 minutes. She also suggests it for headaches. Itching, hives, canker sores, mouth ulcers, and viral lesions are not only an allergic manifestation, so they can be a symptom of histamine intolerance, but they're also related to hypocalcemia. So an excellent protocol would be to address these not only with the natural antihistamines such as Antranex, and you could also use MediHerb Black Cumin Seed Forte because that's also an excellent antihistamine. But here is 1 per hour of Antranex, Calma Plus. And again, Calma Plus is going to be really important, especially if that parathyroid has been involved, just to help balance out calcium levels. Super EFF and Zypan, just for some extra digestion support. And again, you don't have to take this usually longer than a few days. Here, I thought this was a great one too. A pilot from FedEx, he said that calcium lactate is the only one that works for him. So, and this was provided from one of the practitioners that I work with. And she said that his hair analysis showed a deficiency of calcium, and he didn't do well with dairy products, does a lot of international flying. Whoops. And he said that calcium lactate is the only one that works for him. So I thought that was fun. And that is all that I have for you, and would be happy to entertain any questions.
Wow, thank you so much, Kim. We do have a question from Renee, and I'm glad that Renee asked this question because I've heard this question before, and I think it needs to be addressed. Renee learned along the way that we can only absorb 500 milligrams of calcium at one time. So let's see, Renee prescribes calcium, magnesium in divided doses, about 1,000 milligrams to 500 milligrams, milligrams of magnesium per day. And recommended amount of calcium is around 1,000 to 1,200 milligrams per day for most age groups. Is this just an issue of like comparing apples to oranges when they say that we can only absorb 500 milligrams of calcium? Has this just been tested on calcium carbonate, or?
That's what I'm thinking. So the number one type of calcium that's prescribed by doctors is calcium carbonate, and a very low absorption rate of only about 20 to 30%, if even that. So that means that they're getting only 200 to 300 milligrams per day if they're taking 1,000 milligrams of the calcium carbonate. I had not heard that you're only absorbing 500 milligrams of calcium at a time. So you could break it down if you want to. I actually take my Food during the day, and I take my calcium lactate at night. You could try that. Does that answer the question, or is there more to it?
Okay, well, Renee says thank you, but Renee, you're free to unmute yourself if you have another facet to this question. It wasn't really a question, it was more of a statement, right?
Yeah, so again, you have to remember, okay, where's all of that other calcium going? So exactly, so that's the bad calcium. And the fact that calcium or mineral deposits can attach themselves to fatty deposits on our arteries, that's not good either. There was something, so then there are a gazillion types of calcium out there. So there's calcium citrate, which is another very commonly prescribed calcium. That's still calcium carbonate, that has been mixed with citric acid or a type of vitamin C. Again, that's the need for acid. And with ours, you've already got, it's already in an acid base, and it's not from calcium carbonate. It's a natural fermentation from fermented beets. So it's going to be much easier to digest.
Renee, did you want to chime in?
Okay. Yeah, no, thank you. I think that was really useful information. I was curious about that. And also that's interesting to know about the citrate, because I've, learned along the way that citrate was more absorbable. So that's kind of like what I've tended to carry in my dispensary. But now with standard process, I'm, looking at the different calcium products. So I'm really excited to take this webinar and learn more about those and how to use them. So.
Oh, thank you, Renee. And I'll respond to your email this morning after the webinar as well.
Oh yeah, thank you.
I haven't forgotten about that. You're welcome. So calcium citrate, calcium orotate was one that was a rage. I mean, that's just bound to orotic acid. So most of the calciums on the market are calcium carbonate mixed with a type of acid. But again, you've still got the issue of calcium carbonate. And why not just take it from a source that's much easier to digest right off the bat, so you don't end up with the anxiety of bad calcium roaming around in the body.
Right. And also, another question related would be with the Food powder, like normally through time, I've given calcium and magnesium together because I feel like they're really important for balance, with magnesium more expanding and calcium more contracting. So normally I would give it with that. In terms of thinking about the Food powder, doesn't have sort of any magnesium. So I guess if I'm thinking about using that, I might try to use another product for magnesium. It looks like the magnesium in it.
It does have the magnesium, and that it's in the balance also. That magnesium also helps contribute to the acid balance of the calcium lactate. So you are getting a calcium magnesium product in there.
In that one, yeah.
In calcium lactate.
Right.
We have another question.
Okay.
Good. Okay. Joey says, can you talk about Cal-Ammo specifically for dehydration? I often get clients who are dehydrated and object to increasing water increases urination. Yeah. I often recommend adding some sea salt to water, but wondering about what's going on when the water isn't getting into the cells and goes right through them. Could you comment on this, and if Cal-Ammo could be thought to help with this?
I'd absolutely try Cal-Ammo. The other thing you could do, but a lot of people don't like it, is you could add a little bit of apple cider vinegar to the salt water. I'm not quite sure how to respond, Joey, to your question on the Cal-Ammo, other than I probably have some additional research that I can email afterwards. I just cannot pull it up on my computer right now. Would that be helpful? Let's see.
Joey, you're free to unmute yourself if that's quicker. Yeah, she said, yeah.
Yes,
Joey
thank
says,
you so
yes,
much.
thank you.
Hi, Joey.
Hi.
Great.
Okay, never mind. Thanks.
Joey, if you have another question, go ahead.
And I'll email you what information I have on Cal-Ammo, but I would say absolutely give it a try.
And what kind of dose would you recommend with that?
So I'd probably anywhere from 3 to 6 daily, depending on the severity of their dehydration. Okay. What are their symptoms?
Well, she's, I'm sorry, she's not completely fresh in my mind. I mean, she's severely constipated. So we're working on digestion and cleaning up her diet and improving, getting things moving. But one of the things, she was barely drinking water. So I was like, okay, well, let's work on that. And I often get people just object, where it doesn't seem like the water is getting in. and I feel like it's a common theme. I just had somebody do a broth detox that I lead this broth detox, and they did 3 days of bone broth, and somebody said that she finally stopped urinating so much.
Oh, interesting.
And I was thinking that that it was probably so hydrating that there would probably the mineral, like it probably just nourished her, so it shifted something for her. But I was
Yeah.
trying to understand this a little bit more because it comes up, it seems to come up a lot.
Regarding bone broth detox, that's very cool. So they just go on 3 days of bone broth only?
Yeah, primarily some, if they're, I have them put a little fat in their broth if they're having, if they're needing a little energy.
And are they drinking water too?
Yes.
Or is that, oh, okay. I love that. I think that's great. And I'm guessing she's probably protein deficient and calcium deficient as well.
Okay. Protein deficient. Yes, definitely. What makes you, and the calcium, can you just reemphasize why the calcium?
Because calcium is going to be the most abundant mineral in bones.
Okay.
So yeah, trace minerals are going to be important for her. Calcium Food's probably going to be a great product for her if she's willing to take that. I'd suggest the wafers rather than the powder, especially if she's not drinking much water.
Okay. Thank you so much.
Oh, you're very welcome.
Yeah, that's an interesting question, especially given some people don't drink enough water and some people are just drinking water all the time in this effort to hydrate and not really responding to their thirst, I find. Okay, we have another question. Joe says, you mentioned Cataplex F for calcium tissue absorption. Is there another fatty acid that is good for this?
Cataplex F or vitamin F or unsaturated fatty acids have been used traditionally in my training with standard process for years. But I would say, yes, you could probably use any other fatty acids to help facilitate transport to the tissues of the body.
Joe, does that answer your question, or do you want to unmute yourself and ask any other facet of your question?
Hi, Kim. Actually,
Oh,
I was, hi. Well, this Cataplex F is mainly arachidonic acid. So I was just wondering if there's a different type of fatty acid that might also be able to aid in the calcium absorption into the tissue.
I would say just probably any of them are going to be a good job. I just have always used the Cataplex F. And I especially like the Cataplex F tablets just because there's a little bit of iodine that's in there as well.
Right, and I
Yeah,
understand
you should be able to use any of them.
that also with the calcium lactate, Cataplex F, and vitamin D. Can you address this in terms of like sun exposure and avoiding sunburn?
Interesting. I know of people that use that for sun exposure with absolutely no sunscreen, and that's fine if they want to do that. And there is a balance, but that's not something I personally do.
Okay.
Yeah, I don't want to take a chance with the sunburn. But there is a balance between vitamin D and the unsaturated fatty acids known as vitamin F and calcium. So basically, if you're getting too much sun, they recommend increasing your fatty acids, or in this particular case, vitamin F or Cataplex F. And again, most of us can be calcium deficient, especially if we have muscle cramps. So my recommendation, if you're going to get a fair amount of sun exposure, is to go ahead and use that program, including the calcium.
Okay, thanks.
You're welcome. Thanks for being on.
Anybody else have other questions? All right, don't forget that if you think of questions the minute we finish the webinar, you're always welcome to get in touch with us. Renee, you have something
I
else?
have a quick question. Yes, I was curious, when Because I know obviously being like a Chinese medicine doctor and we think about the body in a lot of more nuanced ways than Western blood tests will show things often. And in terms of the blood tests for calcium, like the Western blood test for calcium, have you seen sort of people who have like normal calcium levels on their blood test, but still displaying some of the signs and symptoms that would require to have more calcium added to their diet? Because sometimes I think through time I've had patients where I said, I think it would be good to have calcium, but they say, well, my blood test came back and it's fine. But to me, it speaks to a need for more. So I'm curious about that.
Right, that's an interesting question. I have not seen that particular example before, but there are other tests besides blood tests that can be used too. One is called the tissue calcium test or the calcium cuff test. It's also known as, I think, Lowenberg's test. And that's where you put a blood pressure cuff around the calf. And this is a manual blood pressure cuff. This is, I think, a really cool tool that I believe was used by doctors 50 years ago that I think is still valuable. And that's where you wrap a manual blood pressure cuff around the calf and you start to exert pressure. A patient should be able to handle about 200 millibars of pressure against their calf.
Okay.
Yeah, and if they don't, it's a really good example of calcium deficiency.
Wow, that's great. I will do that. I have a blood
Okay.
pressure cuff, and that'd be a great way to be able to test right in the office.
Absolutely.
If I'm finding a skeptic, which I actually have a case right now that I'm working with, that I think that could be useful to do with so.
It makes a huge difference. And then you can actually use the products. Typically, if it's something that they can chew or put under their tongue, if they can put it in their mouth and even hold it on their mouth, their body starts to recognize it and start to absorb it. You might be able to get a change that quickly in your office where you take the test again with the right product. You'll find out, you'll be able to take that test again and they will be able to handle more pressure on their calf.
Right on. That's great.
Yeah, it's immediate.
Thank you. That's
Yeah.
awesome.
Yeah.
Love it.
Oh, good.
They'll
Glad
see
to
it right.
help.
They'll see it right then and there after you give them the calcium.
Yeah, I think that's a great test.
Yeah.
Super. Okay, great. Thank you so much.
You're so welcome. If you want more information, I will send that to you as well.
Sure. Yeah,
Okay.
I would love that.
Okay, you got it.
Anybody else? All right, everybody. Thank you so much for joining us. And as always, drop us a line if you have more questions or comments.
And thank you, wonderful Sharon, for getting me started on these
Thanks so
webinars and
much.
being my co-host. I so appreciate working with you. You're wonderful. And thank you everybody for being on. And then this is being recorded and it will go on my website soon.
Great. Thank you, Kim. Thank you,
Thank-
Sharon.
Great.
Good to see you.
Thanks, Renee. Nice to see you.
Okay. All right, bye-bye.
Bye,
All righty.
everybody.
Bye,
I'll go ahead and
everybody.
stop.
All right. I'm wondering if they have the calcium cuff test on YouTube.
Oh, that's a really good point because I like the idea of it being